I consent to being recorded.
Hi, Hal.
Hi.
Hi, Hal. My name's Braxton. I'm a graduate nurse anesthesia student. I'll be working with your anesthesia team. How are you doing this morning?
Good.
Good, excellent. Well, like I said, I work with anesthesia. I'm going to do your preoperative assessment. Goals of this, we want to make sure it's safe for you to have anesthesia. And then we'll talk to you a little bit about the anesthetic plan we have for you. Make sure you're good with everything we're going to do for you. Okay, sound good?
Mhm.
Okay. Before we get too much further, could I get your full name and your date of birth from you?
Sure.
Yeah, and I'll
Uh,
check your wristband while we do this.
Harold Becker, 19 or March 12th, 1956.
Okay, excellent. And what are we doing for you today?
The carotid endarterectomy.
Yep, carotid endarterectomy. We're gonna clean out that carotid artery there, get some better blood flow to your brain.
Yep.
Okay. Any allergies to any medicines at all?
Nope.
Nope. Okay. How about past medical history? Do you have any medical conditions?
Mm-mm.
Nope. Okay. Do you take any medicines at all?
I take a few.
Okay, what do you take?
Lisinopril, metformin, aspirin, and a torvastatin.
Okay, and when's the last time you had those medicines?
Um, 24 hours ago.
24 hours ago. Okay. We'll probably give you your torvastatin and aspirin this morning yet, but I'm glad you held those other two. Okay. Typically, we like those held for about 24 hours before surgery. Do you smoke at all?
Mm-mm.
Drink? Any illicit drug use?
No.
Okay, very good. Um, when's the last time you ate or drank anything?
Last night.
Last night. Okay, very good. Do you ever have any shortness of breath at all?
Mm-mm.
Okay. How about any wheezing, chest tightness?
Nope.
Have you been coughing anything up? Any fevers recently?
Mm-mm.
Okay. How about any chest pain, either with rest or activity?
Nope.
Okay. Ever had history of heart failure or heart attack?
Mm-mm.
Do you have a pacemaker at all?
Nope.
Okay. If you climb up a couple flight of stairs, are you able to do that without getting really short of breath or dizzy or chest pain?
Yep.
Yep. Kind of very good. How about any history, strokes, seizures, numbness or tingling in your arms or legs? How about
No.
weakness on any side of your body?
Nope.
Okay. How about diabetes, thyroid issues?
No.
Your labs look good as far as your kidneys go, but are you able to make urine okay?
Yeah.
Okay. Your liver looks good. You don't look jaundiced to me at all. Um, let's see what else. When you lay flat, do you have any reflux at all?
Mm-mm.
GERD? Okay. Um, and then how about blood clots? You ever have any blood clots form that you take blood thinners for?
Nope.
Okay. How about any easy bruising or bleeding that's difficult to stop?
Nope.
Okay. Any history of blood transfusion before?
Nope.
Okay. And you said the last time you ate was last night. Would you be able to tip your neck back for me? Open your mouth as wide as you can. Stick your tongue out. Very good. Go ahead, relax. Is there any stiffness in your neck at all when we do that? Okay. Are you able to bite your upper lip with your lower teeth? Excellent. Very good. And then tip your neck back for me one more time. I'm just going to feel around your throat here. Okay. All right, that all looks very good. I'm going to listen to your heart and lungs here real quick. Can you just go ahead and lean forward for me just a touch? There we go. Take a deep breath in. Very good. Same thing here. And again. And again. Very good. I'm going to listen to your heart. Just breathe normal for me. All right, that all sounds very good. Thank you for that. Your vitals all look really good preoperatively. Your labs look really good preoperatively. We'll plan on doing what's called the general anesthetic for this procedure. What that means for you is once we get you back to the operating room, we'll put on a bunch of monitors, okay? And then we'll have you breathe through a mask, just oxygen. We're going to get your lungs completely filled with oxygen. And then we'll go off to sleep pretty quick. We'll go off to sleep with medicine through your IV. Once you're asleep, we'll put in a breathing device that kind of protects your airway throughout the procedure while you're asleep. And then we'll start a couple IVs. So we'll do an IV here, and then we'll do a special one that goes in your wrist, monitors your blood pressure throughout the procedure, okay? This one you may or may not remember in the recovery room, but that one usually comes out pretty quick in the recovery room if everything's looking like it's supposed to. Okay. Um, Otherwise, that's really it about the anesthetic plan for you. And you said you've never had anesthesia before. Any history of family complications with anesthesia?
Mm-mm.
Do you get sick easily? Do you get nauseous easily?
No.
Okay. We do give you a couple medicines to kind of help with nausea. Sometimes people struggle with that. Since you don't have a history of that, we wouldn't expect it to be a big risk factor, but we do give you some medicines for that. As far as pain control, The surgeon injects some local anesthetic around their incision, so we don't typically see a lot of pain with this afterwards, but we do give you some pain medicine throughout the procedure as well to help with that. Okay. What questions do you have for me about the anesthesia plan?
I don't think any.
Nothing? Okay. We do have a few consents for you to sign. One is the blood consent. We don't anticipate needing to give you blood for this procedure, but in the event that we do, we like to have your permission to give you some. As far as risk with blood, um, there's very low risk as far as transfusion reactions. We do an extensive matching process to make sure that the blood we give you is similar to the blood in your body. That helps mitigate the reaction. There's a small risk of infection as well. But blood, when you're losing blood, we need that so that it carries oxygen to your body. Okay, that's the reason why we give you blood. Okay, so if you're okay with that, we'd like you to sign that consent and then put your signature there, and then we'll date it for you. Okay. And then the anesthesia, we kind of talked about what we're doing for you with the general anesthetic. As far as risks go, pretty minimal risk. You might have a sore throat afterwards. Sometimes we're extremely careful when we put the airway instruments into your mouth, but sometimes we can nick your lip a little bit. You might have a fat lip afterwards. Sometimes teeth get knocked around, but we try to be very, very careful while we're doing that. Okay. If you're okay with the anesthesia, we'll have you sign that anesthesia consent as well. And then as far as the surgery goes, we don't, as anesthesia providers, we don't get too far into the surgical details. We kind of leave the risks and benefits to the surgical team to discuss those with you. But we do want to make sure that you're okay with having the carotid endarterectomy with Dr. Jones. And if you are, then we'll have you sign that one as well. Okay. Any questions for us?
No.
Okay, we'll circle back around and we'll take you back up into the OR here shortly, okay?
Sounds
All righty,
good.
sounds good. Nice to meet you, Hal.